There is a lack of specialized psychiatric doctors to address a range of mental health disorders affecting the country. This was just one of the revelations coming out of a joint select committee sitting of the Parliament on the Social Services and Public Administration to address the state of mental health services and facilities in Trinidad and Tobago. As of 2012, approximately 1/4 of the population, or 1 in 4 persons, was afflicted by mental illness. Marie Hall has more.
Medical Chief of Staff at the St. Anne's Hospital, Dr. Hazel Othello, said while there are a number of students at the university studying to become general psychiatric doctors, the subspecialty to address ranges of disorders is missing. This shortage, she said, is significantly affecting diagnosis and treatment in this country.
The area of difficulty is the subspecialties. We have only 2 people trained in child and adolescent psychiatry, one of whom is post-retirement, who continues to give her service on a part-time basis. In addition, we do not have any geriatric psychiatrists in the government service. There's one person that I know of locally in the private practice. So that the subspecialty areas are where the difficulty is.
Trinidad and Tobago's main mental health issues are identified as schizophrenia, mood affective disorders, mental and behavioral disorders, and substance abuse. Member of Parliament for Tokosani Grande, Glenda Jennings-Smith, questioned the process for the removal of mentally unstable people from the streets. She said police officers are not equipped to handle such a task.
Police officers are not trained to deal with mentally ill people, and you are the institution charged with that responsibility. And to come here and say you don't know how many persons were brought in for the year, that is unsatisfactory, because you know a number of institutions are charged with responsibility, and we pass the buck. If we stand up and insist that things are carried out as we are authorized to do, we would solve all the problems.
Dr. Othello later said that a mental health officer trained as a community psychiatric nurse is tasked with the responsibility. She also said the Northwest Regional Health Authority has only 25 mental health officers/nurses.
For Northwest, we have 25. And I would add that Northwest covers from Diego Martin all the way east to Toko, and we provide services all the way down to Rio Claro.
Dr. Othello said this category of nurses only work Monday to Friday, which poses a challenge in removing the mentally affected people from the streets.
Because we may look at statistics and they may mislead us. So we may look at a certain number of admissions and say that looks relatively small. But we have to remember that sometimes our mental health officers work 8 to 4 Monday to Friday. That is their current collective agreement. And if sometimes they go in search of a person based on a report they receive, and by the time they reach that person has left, sometimes they go several times in the same week, and they do not find that person.
At the JSC meeting, it was also suggested that a public education campaign about mental illness should be put in place to assist in removing the stigma. Marie Hall, CNews.